Is this a partisan approach to health care? I don't think so. If Missouri does better, there's a Democrat representing Missouri, there's a Republican representing Missouri. Here's the good news, we got the Republican on board, and we appreciate the Republican. Let me tell you how this works. I like Massachusetts, I like Maryland, I like New York, I like California, but I don't like them that much to give them a bunch of money that the rest of us won't get. Now, if you live in Massachusetts, you don't get twice the Social Security, or 50% more than if you live in Pennsylvania. How can this happen? Obamacare, for whatever reason, favors 4 blue states against the rest of us. Now, our friends in Mississippi, like South Carolina, we have a 31% African-American population in South Carolina. I think the highest in the country is Mississippi. Under this block grant approach, our friends in Mississippi get a 900% increase. How can that be? Well, that's money that was going someplace else other than Mississippi. So what have we learned about Obamacare? Rural poor, particularly African Americans, don't do so well. These 4 states, New York, California, Massachusetts, and Maryland, they got a lot of high wage earners. You got some rural poor states. Missouri is a very wonderful state. Big cities, rural areas. How do you get more money? Well, under this formula, you're getting money that would have gone to the 4 other states. 50 to 138% of poverty. There's 45 million people in America, Mr. President, fall in that demographic. We can figure out how many live in Missouri. And we use that as the basis for the formula. You're not limited to spending the money on 50 to 138% of poverty. That seems to be a fair way to redistribute the money. So by 2026, the goal is, no matter where you live, Missouri, South Carolina, or California, you're going to get the same basic contribution from the federal government, regardless of where you live. What a novel idea. That means places like Missouri and South Carolina do better. To our friends in New York and California, we're giving you a long time to come down. To our friends in Massachusetts, and we got a great Republican governor, I don't know how to explain a system where you get that much more money than everybody else. The goal is for you to have time to adjust, become more efficient, and Charlie Baker can do this. Is it unfair for people like me and Louisiana and Missouri to say, no 4 states should get twice their population? I'm trying to fix a problem in Obamacare. Now, who should get the money is another question. Should some bureaucrat you'll never meet in Washington be in charge of your health care? Or should somebody that you actually know and vote for be in charge of your health care? The block grant has a beautiful concept to it. The people we empower, you actually live with them and you vote for them. If you don't like Obamacare, and God knows if you don't like Bernie care, who do you complain to? You can tell me I don't like Obamacare, my premiums have gone up, my deductibles are going through the roof. You can complain to me all day long and I'll call somebody up who could care less what I think. Now, if you had South Carolina responsible for the money, instead of some bureaucrat in Washington, let me tell you what would happen. You'd call me up and say, hey, listen, this is not working for my family. I'll find out who the State House person is, and we'll call them together. And I guarantee you the governor will listen to you because the governor wants you to vote for him or her. The bottom line is the concept of who should be in charge of your health care is what this is all about. Our friends on the other side deserve a great compliment. You know where you're going on health care. You got a plan to get there. I just don't agree with your plan, and I don't agree where you're taking the country. But I will say this for you, you got a plan. And I will say this for my Democratic colleagues. When it comes to your ideas, you fight like tigers. I remember voting on Obamacare on Christmas Eve, for God's sakes. And we would have been here Christmas Day if that's what it took for Harry Reid to pass Obamacare. Now, on our side, have we done everything we could to repeal Obamacare? Because they did everything they could to pass it. President Trump is now behind this bill. Thank you, Mr. President. I appreciate it very much. Without your voice, we cannot succeed. With your voice, we will be successful, but it's going to take more than a letter. Get on the phone. Start calling people. Obama did. Senator McConnell was very good today in lunch, saying this is a good idea, we need to get behind it. CBO score is necessary. I'm sure there are a lot of good people at CBO. But if I had one place to go before I died, it'd be CBO, because you'd live a long time. We need to get CBO to score things in a timely fashion. To my friends at CBO, this is a block grant. We're going to spend $1.2 trillion in the next decade. Not more, not less. I didn't do that well in math, but I could figure out how much we're going to spend. I don't mean to be super critical, but we haven't had scores on the Portman language, on the Cruz language, 8 weeks. Let me tell you, to my Republican friends, if you're upset about us not successfully repealing and replacing Obamacare after 7 years, count me in. We tried, and we were one vote short. We got 17 days left. What would the Democrats do? They would be fighting. There would have been no August break. We'd be right here on this floor. We'd be arguing about their view of health care. So I'm encouraged that our leadership is going to push the CBO and get behind this bill. I'm encouraged that the president came out for the bill. The vice president, above all others in the administration, has been on the phone calling governors. We got over 15 governors now on the Republican side saying, give me the money, give me the power. I can do a better job than some bureaucrat in Washington. To the other Republican governors, check it out for your state, but here's what I would ask you to consider. The money you're getting from Obamacare is unsustainable. It's a false promise. It's going to collapse, and we can never match that system, because that system is unsustainable, is going to fail. What have I learned about Republican governors? Most of them practice what they preach, and some of them it's been hard to get on board. It's almost like crack cocaine in terms of Obamacare dollars. I'm telling you right now, Republican governors and Democratic governors, this system's going to collapse in Washington. There's not enough money to keep it afloat, and I'm not going to spend good money after bad. This is a chance for you at the state level to have control over funds, as flexible as we possibly can be, to design systems that make sense for your state. If California wants to go to single-payer health care, they can. If they want to reimpose the employer mandate, the individual mandate, they can. But we repeal the individual mandate, the employer mandate for the country at large. But if you want to put it back in place, you can. Here's the good news. California can't take the rest of us down the tubes with them. And we'll have a debate in California about what works and what doesn't. Give South Carolina, Louisiana, and Missouri the space they need to design health care based on their individual demographics. You can't spend the money on football stadiums. You got to spend it on health care. You got to take care of people who are sick. There are guardrails around this block grant. But innovation will flourish. Under Obamacare, where's the incentive to be innovative? All you need to do is print more money. Under Bernie-Care, there's zero incentive to be creative, just tax the rich. This is what happens. We go from 4 states getting 30-something% of the money, representing 20% of the population, to where basically everybody gets the same. Let's talk about Medicaid. Bernie Sanders, who's a good man with a good heart and an avowed socialist, he's the most honest guy in this building. If you left it up to Bernie, we'd have a rowboat for a Navy, a gun for the Army, and a prop plane for the Air Force, and everything else be spent on entitlements. Most of us are not in that camp. Medicaid is a program for low-income Americans to help them with their health care. There's a state match. Right now, we're spending almost $400 billion on Medicaid. By 2027, we're going to be spending over $650 billion. That's more than we spend on the military right now. No end in sight. So we do 2 things in this bill. We tell the states that we're going to give you more flexibility. This is what we spend on the military, $549 billion under sequestration. Hope that number goes up, but by 2027, we're going to spend more money on Medicaid, let alone Medicare, than we do on the military. That's just unsustainable. So what do? We keep Medicaid in place as it is today. We try to give more flexibility, because Indiana was a good example of what can happen if you give states flexibility to help poor people. The one thing about Medicaid I don't like is if you get a headache, you can run to the emergency room, we pay a big Medicaid bill. I want to put Medicaid people into managed care. I want them to have some ownership over their health care. If you smoke, then that's something that ought to be considered in terms of cost. I like co-payments. I want to treat people who are low income and poor fair, but all of us need to be responsible for our health care. Rather than having a Medicaid program that just writes checks no matter what the outcomes are, we're going to, in year 8, begin to slow the growth of Medicaid down. It grows faster than medical inflation. Medical inflation is what it costs for you and your family. Medicaid is way beyond that. Why? Because it's inefficient. We've proven at the state level you can get a better bang for your buck for Medicaid. So the bottom line is the first block grant begins to slow the growth of Medicaid to make it affordable for the rest of us and incentivize innovation in year 8. And if we don't do that, here's what happens to the country. By 2038, all the money you send in taxes to Washington goes to pay the interest on the debt, Medicare, Medicaid, and Social Security. There won't be one penny for the Department of Education, Department of Defense. That's how quickly these programs are growing. So we do 2 good things. We put Medicaid on a more sustainable path because it's an important program, and we allow flexibility to get better outcomes for the taxpayer and the patient. What a novel idea. The second block grant. This is money that would have been spent by a bureaucrat in Washington. Under the first Republican proposal, you would get a refundable tax credit to go out and try to buy insurance somewhere, and we would give insurance companies money so they wouldn't collapse on the Obamacare exchanges. What we've decided to do is, instead of giving a refundable tax credit to an individual to buy a product that's going to go away because Obamacare won't work, instead of giving a bunch of money to insurance companies to prop them up, we're going to take that same amount of money and give it back to the states so by 2026, they all get the basic same contribution. Now, what did we do? We repealed the individual mandate, the employer mandate. That's $250 billion of savings. States can reimpose if they like. That's up to the states. We repealed the medical device tax because that hurts innovation. We left the other Obamacare taxes in place. There's no more taking from the poor, giving to the rich. I wish we didn't have to do that, but we need the money to transition in a fair, sound way to a state-centric system. So to my friends on the other side, we leave the taxes in place. We just give the money to somebody else. It's called state control, local control, not Washington-based health care. And we do it in a way where basically everybody gets the same contribution from the federal government. What a novel idea. Now, to President Trump. Without you, we can't do this. Your pen will be the one that signs the law if we can ever get it to your desk. You said today you would veto Bernie Sanders' care. Let me tell everybody in America, don't worry. Single-payer health care will never get through the Republican-controlled House. We have the majority in the Senate. Mr. President, we're not going to need you to veto single-payer health care. What we need you to do is put in place a new system to stop the march towards single-payer health care. Because if we don't change where we're going, the federal government's going to own it all from cradle to grave. Mr. President, on your watch, you can stop that. Once we get the money and the power out of Washington, that's the end of single-payer health care. Once people know they have somebody to respond to their needs at the state level versus some bureaucrat they'll never meet, there's no going back to Washington-based health care. So, President Trump, you have the chance in your first term to set us on a new path. Health care closer to the patient, money based on not where you live, but parity, innovation versus bureaucracy. What a legacy it would be. But for that to happen, and I know you're busy with hurricanes in North Korea, you're going to have to get on the phone, and you're going to have to help us sell this. And I believe you will. I know you can, and I'm asking you to do it. To Senator McConnell, thank you for what you said today. Thank you for being willing to push this forward. To my colleagues on this side, there's 3 options left for America. Propping up Obamacare, which will never work. Bernie Care, which is full-blown single-payer health care, or this block grant approach. I ask a question. Who are we and what do we believe as Republicans? Our Democratic friends are pretty clear on who they are and what they believe when it comes to health care. Here's what I believe. Send the money home. Send the money back to where the patient lives. Put it in the hands of doctors and hospitals in the community and make sure that the people in the state are responsive to the needs of the individuals in that state. Replace a bureaucrat with an elected official. You'll improve quality, and outcomes will be better, and it will be more fiscally sustainable. At the end of the day, those governors, whoever he or she might be, that can figure out quality health care in a sustainable fashion will not only get reelected, but other people will copy what you do. If we leave the money and power here, there's never going to be any innovation. It's always going to be more money. Single-payer health care only works with a printing press. Unlimited dollars. Just keep printing the money. A block grant will bring out the best in America. It will create better outcomes for patients, and it will take us off the path of becoming Greece. Because this is where we're headed. Senator Cassidy was a doctor in a low-income nonprofit hospital. He knows more about this than I could ever hope to learn, and there's a reason I didn't go to medical school. I could not get in, and I just cannot tell you how impressed I've been with Bill Cassidy's understanding of how health care works for average, everyday working people, because you dedicated your life to that segment of the population. Rick Santorum, there would be no Graham-Cassidy-Heller-Johnson without Rick. Rick said, Lindsay, we did this with welfare reform. They said we couldn't do it. We block granted the money, unleashed innovation at the state level, and not one dime of extra spending has occurred since 1996 because we were generous in the beginning and the governors figured it out, and it was a better way of dealing with welfare population. I had a bill to opt out of Obamacare. Rick said, why don't you just do the block grant like we did with welfare reform? And when you look at it, it's such an elegant, fair, common sense solution to a complicated problem. Dean Heller. Dean Heller is in the fight for his political life. A lot of people around here, and I understand it, I'm included sometimes myself, just wish hard problems will go away. This is a tough business to be in. But Dean was told, and he said this today by all the experts, just lay low, don't get your fingerprints on this health care debate. There's no winners. Health care is too complicated. We just can't, you just stay away from this fight. Lay low. And Dean told us today in the conference, I didn't get elected to lay low. If we don't get health care right now, all of us are going to pay later. So Dean Heller, in one of the most competitive seats in the country, said, sign me up. Nevada gets 30% more money under this formula. They get more control than Obamacare would ever give them. And Dean Heller believes that Medicaid is worth saving, and this is a way to save it. The second block grant, 20% can be used to help traditional Medicaid. The bottom line is that Dean Heller stood up today and said, nobody in this conference has a tougher race than I do. Count me in because this is the right thing to do. Ron Johnson. If there was ever a Mr. Smith goes to Washington, it's Ron Johnson. This is his last term. If you want to have an interesting evening, do not go to dinner with Ron Johnson and Bill Cassidy. They are wonderful people, but they know numbers. And they love to talk about details and how systems work. Ron Johnson has brought energy and a can-do attitude to this debate. He's the closest thing I've seen in a long time to Mr. Smith goes to Washington. He's not going to run again. He's doing what he thinks is best for Wisconsin and the nation. Scott Walker. If it were not for Scott Walker, we would not be here today. Scott Walker said, I have been talking about federalism all my political life. This is the first time I've seen somebody in Washington try to empower me here since welfare reform. Scott Walker has been the moving force on the governor's side. The governor of Utah, Mike, you should be proud of him. Really great guy. And Mike, thank you for working with us to make this as flexible as possible. Senator Lee is really driven very hard to get as much flexibility at state level as possible, and thank you. Your governor has been just absolutely awesome. Asa Hutchinson in Arkansas stepped up. Our good friend, Governor Bryant in Mississippi, he is all in. I could go on and on and on. I know John McCain likes the concept of the block grant. John McCain wants to reform health care. He knows what happens to Arizona under Obamacare, and this is our last best chance to stop what I think is a march towards single-payer health care. I hope our friends in Arizona at the state level that we can find a way to get you on board, because Obamacare is failing your state, and if we don't find a replacement, and I think this is a great replacement for the people of Arizona, everything's going to collapse. So to all those on the staff who've spent hours and hours and hours of listening to us change our mind, do it one way, do it another, thank you, thank you, thank you. I've been in politics now. I came in a little bit before the president, presiding officer of the Senate. Worked on a lot of things, had a lot of fun, a lot of disappointments. I don't think I've worked on anything more important than this. It's been fun, it's been frustrating, but I do believe this is our last best chance to get health care on a sustainable footing and to stop the march towards single-payer health care, which I believe with all my heart will reduce quality and explode in cost, and that doesn't have to be the choice. To my Republican friends, they know what they're for. Do we know what we're for? They're committed to their causes. Are we equally committed to ours? I hope the answer is yes. And if we can get 50 of us here, I'll make a prediction. A few of them over there are going to sign on because their state does so well. There are some Democratic senators who are my dear friends that are going to have to turn down more money and more power for their state to keep the status quo. And I can tell you this about bipartisanship. I'm a pretty big believer in bipartisanship. I've taken my fair share of beatings working on immigration. I believe climate change is real. I've done deals, and I understand that you've got to work together. But our friends on the other side are never going to vote for anything that fundamentally repeals and replaces Obamacare. They just can't do it. And they're not bad people. They're just locked into a different way. And their way is that the government makes these decisions, not the private sector. My belief is that health care closer to the patient, like government, is better health care. This is the last best chance we will have to stop the march toward single-payer health care. Mr. President, we need you. We need the weight of your office and the strength of your voice. Senator McConnell, thank you for what you said today, but all hands on deck. Our friends on the other side, they moved heaven and earth to pass Obamacare. I'm going to do everything I can to repeal Obamacare and replace it with something that's not good for Republicans. It's good for Americans. Because many, many Democratic states, including Illinois, do far better under this approach than under Obamacare, and all of us will do better than Bernie-care. Mr. President, if we don't stop this now, single-payer health care is the fate of the nation. To all who have been involved, thank you very much. We can do this. We've got the time. Do we have the will? I yield.